Welcome to this presentation on cytokines, which are the essential immune system mediators. What is TNF alpha? The TNF alpha plays two important roles. One is that it increases the vascular permeability, thereby decreasing the systemic vascular resistance. When that happens, it results in hypotension in septic shock. It is the most responsible cytokine for septic shock presentation. It is also known as the cachexia factor, that is the main cytokine responsible for weight loss in the setting of the malignancy. The weight loss in malignancy is not a paraneoplastic syndrome, it is due to tumor necrosis factor alpha. What is interleukin 1 does? It is a fever producer, but it causes fever in response to infection and inflammation. When there is a low BP, when there is fever, it is the typical septic shock which is caused by TNF alpha and interleukin 1. But if they are specific and ask you to pick only one of the cytokines, then it should be tumor necrosis factor alpha. If the question is what is the main reason for fever, then it is interleukin 1. Interleukin 1 also contributes to osteoporosis and lytic lesions in metastasis. Sometimes a osteoporotic bone might be given and the reason behind it is interleukin 1. On the other hand, what is the reason behind NSAIDs decreasing prostaglandins? NSAIDs decreasing fever? It is because NSAIDs antagonizes the prostaglandins. The action of NSAIDs is different from the interleukin 1. Interleukin 2. Interleukin 2 is the T cell activator. The interesting fact here is that T cells will be producing interleukin 2 and the T cells have the interleukin 2 receptor. So, in short, the interleukin 2 acts as an autocrine as well as a paracrine factor. So it has been released by the T cells and it has been acted upon by the T cells. In those situations where we don't want the T cell activation, like in transplant, where we want to suppress the immune system, we give drugs to suppress the interleukin 2. Cyclosporin and tacrolimus decreases the interleukin 2 transcription by inhibiting the calcineurin. Sirolimus decreases the responsiveness to interleukin 2 signaling. In that way, the interleukin 2 which attaches itself to the T cell receptor and causes the proliferation of the T cells is inhibited. Therefore, it results in immunosuppression. Aldesleukin, it is a recombinant interleukin 2 which is used in renal cell carcinoma and metastatic melanoma. In renal cell carcinoma and metastatic melanoma, aldesleukin is given, thereby activating the interleukin 2 and fights against the cancer with the help of the interleukin 2 by activating the T cells. In short, the T cells kills the cancer cells. The aldesleukin stimulates the T cells because it is a recombinant interleukin 2. Interleukin 3, it is a myeloid progenitor. I have a clue to remember this. 3, myeloid stimulator. I have a clue for you to remember this. Interleukin 3, the N has the 3 limbs. So the interleukin 3 is the neutrophil producer. Interleukin 3 will stimulate the myeloid lineage development, primarily increasing the neutrophil production. We can think interleukin 3 as functionally similar to GM-CSF in its myeloid stimulating effects. What about interleukin 4? It is the T helper 2 promoter. The T helper 2 will... How is T helper 2 formed? The naive T cells can get converted to either T helper 1 or T helper 2. So in the presence of interleukin 4 as well as interleukin 10, the naive T cell is converted into T helper 2. The T helper 2 will normally stimulate B cells which mature into plasma cells that secrete immunoglobulins. This means this cytokine is important for supporting humoral immunity. T helper 1 will normally stimulate macrophages which do not secrete immunoglobulins and are a part of the cell-mediated immunity. Interleukin 5. So I have another clue for you to remember this. Interleukin 5, 1, 2, 3, 4, 5. What is the fifth letter? A, B, C, D, E. So interleukin 5 is the one responsible for eosinophil maturation and activation. So this is important in allergic responses and parasitic infections where eosinophil plays a crucial role, defensive role. Interleukin 6. This is the acute phase reactor. This will stimulate the liver release of CRP, hepcidin and other acute phase reactants during inflammation. And it can also cause osteoporosis in addition to interleukin 1. How is this used clinically? Tocilizumab, which is an interleukin 6 receptor monoclonal antibody, will block the interleukin 6 receptor, thereby preventing the interleukin 6 binding to interleukin 6 receptor and also preventing the downstream inflammatory pathways. This is used to treat rheumatoid arthritis. In addition, interleukin 6 and TGF beta together stimulate and cause the differentiation of naive T cells to T helper 17 cells. Interleukin 8, this is the neutrophil recruiter. We already saw interleukin 3 is a neutrophil stimulator, but this is a neutrophil recruiter. In addition to interleukin 8, this set is important. You pay attention. Interleukin 8, C5a, leukotriene B4, platelet activating factor as well as kallikrein. So they are all, and the bacterial products, they are all key neutrophil attractants. Even when they are present, they will direct the neutrophil to the site of infection. So that is the role of interleukin 8. Interleukin 10 is an anti-inflammatory controller. The interleukin 10 or the TGF beta, transforming growth factor beta, will decrease the immune responses. In addition, along with interleukin 4, it will stimulate the conversion of naive T cells to T helper 2 cells, ultimately increasing the activation of the B cells. Interleukin 11, it's a platelet stimulator. It specifically stimulates the platelet production, making it valuable in clinical scenarios involving thrombocytopenia. Typically, following a chemotherapy-induced thrombocytopenia, interleukin 11 is used to stimulate thrombopoiesis. Interleukin 12, the interleukin 12 is produced by the macrophages. In the presence of interleukin 12, the T helper cells, the naive T helper cells will get converted to T helper 1 cells and will start to release interferon gamma. This interferon gamma will again act on the macrophages and stimulate it, activate it, thereby more interleukin 12 is produced by the macrophages. This loop continues until the pathogen or the microbe is killed. In short, interleukin 12 causes the differentiation of T helper to naive T helper to T helper 2's differentiation. The interferon gamma production will again stimulate the T helper cells to produce more interferon gamma, creating the positive feedback. This happens between the macrophages and the T helper cells. In interleukin 12 receptor deficiency, there is increased TB infections because they are of decreased macrophage activity. Interleukin 12 is produced by macrophages, and when there is interleukin 12 receptor deficiency, it means there is a decreased macrophage activity. Therefore, in interleukin 12 deficiency, it will increase the TB infection. Interleukin 12 also stimulates the natural killer cells for enhanced immune surveillance. How is interleukin 12 receptor deficiency treated? It can be treated with interferon gamma supplementation. How? Interleukin 12, if it is produced, then the T helper cells are converted to T helper 2 cells and interferon gamma is produced. So to compensate for the loop, interferon gamma can be given at least so that the microbe can be killed or the pathogen can be killed. Interferon gamma is the one produced by T helper 2 cells to activate the macrophages. Macrophages stimulated by interferon gamma produce interleukin 12 creating reinforcing loop, as I told you. The clinical uses in cases where there is NADPH oxidase deficiency, as in chronic granulomatous disease, as well as an interleukin 12 receptor deficiency, interferon gamma can be used to treat because it is used as an additional to kill the pathogen that is being taken. Interferon, similar to interferon gamma, interferon beta is there, which is used between the multiple sclerosis flares to decrease the recurrence. Acute flare in multiple sclerosis is treated with steroids, but the recurrence is prevented by interferon beta. Transforming growth factor beta. This is an anti-inflammatory. The transforming growth factor beta decreases the inflammation and immune response. Transforming growth factor beta and interleukin 6 together stimulate naive T helper to T helper 17 differentiation. In addition, transforming growth factor beta stimulates naive T cells to Treg cells. They are the T cell regulatory cells, creating regulatory T cells for immune tolerance. This is a master regulator balancing cell. Without this, there are more chances for autoimmune diseases. With this, we have come to the end of the cytokines. I have made it as clear as possible. There is an entire list of topics in the immunology. You can go ahead and check them. I have made it with animation, I have made it with examples, I have made it with mnemonics. So if it is of use to you, I will be happy about it. If you enjoy the slides, don't forget to give a like. Thank you for listening all this while. All the best for your exams.